Imagine stepping into a world where your very body, your thoughts, your emotions, and even your desires are scrutinized, controlled, and pathologized simply because you were born a woman. A world where medical science, rather than offering relief or understanding, becomes a tool of oppression, shaping society's understanding of what is normal, moral, and acceptable, and where the authority of the male physician is rarely questioned, even when it inflicts pain, humiliation, or lifelong consequences. This was the reality of Victorian Britain, a society that proudly displayed its towering achievements in industry, literature, and culture. Yet behind the elegant facades, grand houses, and refined parlors existed a medical culture steeped in prejudice, ignorance, and fear. Fear not of disease itself, but of female autonomy, intelligence, and sexuality. And nowhere is this darker truth more evident than in the widespread diagnosis of hysteria, a condition so vaguely defined that almost any emotion, expression, or bodily function could be interpreted as pathological, from simple anxiety, occasional irritability, or fatigue, to sexual desire, frustration, or sadness, all blamed on the so-called wandering uterus, an organ that Victorian doctors claimed could move throughout the body, pressing on nerves, displacing organs, and wreaking havoc on women's health, an idea so bizarre that today it feels almost fantastical, yet it governed treatment decisions, social expectations, and women's self-perception for decades. And the prescribed cures were horrifying, from the infamous rest cure devised by Dr. Silas Weir Mitchell, which required women to remain in bed for months, forbidding mental stimulation, reading, or social interaction, to mechanical interventions, such as the use of vibrators to induce hysterical paroxysm, a euphemistic term for orgasm, performed under the guise of medical therapy, revealing a disturbingly sexualized dimension to treatment that was cloaked in the language of science and morality. And hysteria, while perhaps the most well-known, was merely the gateway to a host of medical practices that reinforced shame, ignorance, and control over women's lives. For every stage of a woman's biological experience, menstruation, pregnancy, childbirth, and menopause, was heavily pathologized, shrouded in secrecy, and imbued with moralistic judgment, with menstruation described as impure, sexual desire as sinful, and childbirth treated as an event requiring male supervision, often involving invasive procedures like forceps deliveries or unnecessary surgeries, all justified under the guise of medical authority, and the education of women about their own bodies was deliberately restricted, with girls growing up in ignorance. Their natural curiosity met with euphemisms, warnings, or outright dismissal, creating a culture in which women internalized blame for processes they could not understand, shame for desires they could not control, and fear for conditions they could not prevent. A systemic silencing that left them vulnerable to manipulation, exploitation, and lifelong trauma. While the male-dominated medical establishment published dense treatises that reduced women to symptoms, organs, and behavioral tendencies, portraying female experience as secondary, unreliable, and often irrational, and any deviation from the expected norm. Assertiveness, ambition, emotional expressiveness could be pathologized, labeled as nervousness, hysteria, or moral weakness. And in extreme cases, it could justify invasive surgeries like hysterectomies, ovary removal, or clitoridectomy, all performed without consent, rationalized by dubious theory, and reinforced by societal belief in female incapacity. While more everyday treatments, such as the crushing pressure of corsets, leeches, purgatives, and enforced bed rest, physically maimed women, restricted breathing, weakened internal organs, and often worsened mental health. Yet these methods were widely accepted, celebrated even as evidence of the physician's skill, the patient's obedience, and society's moral order, and the cultural reinforcement of shame extended beyond medicine into every aspect of life, as Victorian women were expected to embody purity, delicacy, and domesticity, to suppress sexual desire, to prioritize others' comfort over their own, and to view any expression of dissatisfaction or pain as evidence of moral or physical failure, a dynamic that affected women across social classes, From the laboring women whose exhaustion, malnutrition, and injuries were dismissed as weakness or exaggeration, to the upper-class women confined to drawing rooms, adorned with corsets, and subjected to invasive medical scrutiny, all producing a spectrum of suffering shaped by social hierarchies, but united by shame, silence, and control. And yet, despite the oppressive framework, countless women resisted, documented their experiences, and laid the groundwork for reform. Writing diaries and letters that detailed the terror of confinement, the humiliation of unnecessary procedures, and the emotional toll of being dismissed by the very individuals charged with their care, offering invaluable testimony to the resilience, intellect, and courage required to navigate a medical system designed to subjugate them. And while some reformers and early advocates began to challenge these practices, calling for better education, more humane treatment, and recognition of women's autonomy, progress was slow, constrained by the pervasive cultural narrative that women were delicate, irrational, and inherently susceptible to disorder. And the psychological consequences of these centuries of treatment were profound, as women learned to distrust their own perceptions, to conceal feelings, to self-police their behavior, and to defer entirely to male authority, internalizing shame and limiting the scope of their ambition, intellect, and agency. While the language of medicine reinforced this silencing with terms like hysterical, nervous, and emotional, weaponized to dismiss, discredit, or punish, a pattern that is eerily resonant today as studies continue to show that women's pain is underestimated, their symptoms dismissed, and their experiences marginalized in clinical research and healthcare practice, revealing that the history of Victorian medicine is not merely an artifact of the past, but a blueprint for systemic inequities that persist, making it all the more vital to understand, confront, and correct these legacies. Because the story of hysteria, enforced ignorance, and paternalistic control offers lessons in the dangers of unchecked authority, cultural bias, and the dehumanization of those deemed inferior. Lessons that resonate beyond medicine into questions of education, social policy, and human rights. And as we consider the intersection of gender, power, and science, it becomes clear that Victorian medicine was never neutral. It was an instrument of social control, a way to regulate sexuality, reinforce domesticity, and suppress the voices of half the population, shaping a culture in which shame was prescribed alongside treatment, obedience celebrated as virtue, and silence rewarded. Yet even in the face of such oppression, women's resilience shines through. From the countless letters, memoirs, and diaries that survive, documenting suffering but also resistance, critique, and the assertion of agency, offering both a cautionary tale and a source of inspiration for modern efforts to reclaim autonomy, challenge bias, and transform healthcare into a space of empowerment rather than control. And these historical lessons are not distant. They echo in contemporary issues, from disparities in research to misdiagnosis and neglect, reminding us that vigilance, awareness, and advocacy are essential to ensure that the mistakes of the past are not repeated and that shame, fear, and ignorance do not continue to shape the lives of women today. So as we reflect on this hidden, shameful history of Victorian medicine, let it compel us to demand inclusivity, to honor lived experience, to question authority when necessary, and to embrace empathy, knowledge, and respect as guiding principles in healthcare and beyond. And if this story has opened your eyes, shocked you, or moved you, then take action. Like this video, subscribe for more deep dives into forgotten histories, and share this with others, because understanding the secrets of the past is the first step toward ensuring that every woman, today and tomorrow, can engage with her body, her mind, and her health with confidence, dignity, and freedom, transforming centuries of shame into a future of empowerment, justice, and human respect. A legacy not of fear, but of awareness, courage, and change, ensuring that the hidden truths of Victorian medicine illuminate a path toward a world where autonomy, knowledge, and empathy reign supreme.